Today, the country mourning U.S. Senator John McCain as he lies in state. We spoke with a doctor at Roper St. Francis about the disease that took his life, glioblastoma. News 2's Natalie Price has more.
Senator John McCain lying in state today at the U.S. Capitol. The 81-year-old passed away after a battle with glioblastoma, an extremely aggressive form of brain cancer. I spoke to a brain surgeon here at Roper St. Francis to learn more about the disease.
Unfortunately, only about 25% of people are alive 2 years after the diagnosis, and only 5 to 10% are alive at 5 years.
Glioblastomas are malignant brain tumors found primarily in the left or right hemisphere, but they can grow anywhere in the brain and they don't discriminate.
There is a predominance in the male population versus the female and a little trend toward older age, but unfortunately, the disease can really affect just about anyone.
There is no known cure, and it's not an easy disease to treat.
So typically the first line of treatment is surgery. If we can safely remove the vast majority of the tumor, we know that that gives you the best chance at prolonged survival. And following surgery, treatment involves an oral chemotherapeutic agent and radiation therapy to the brain.
Even with treatment, the patient is only expected to live about 15 to 18 months after the diagnosis. With such a grim prognosis, some doctors will suggest their patients enroll in clinical trials.
Usually there comes a point where we encourage patients to explore the potential for enrolling in a clinical trial, trying some kind of a novel treatment, just to enhance their chances of prolonged survival. There is no known cure.
While the prognosis for someone with glioblastoma is almost never good, it is an extremely rare disease affecting only about 3 in every 100,000 people. Reporting in North Charleston, Natalie Price, Count on 2.